Hello guys and welcome to my channel. Today we are going to understand the drama of myocardial infarction. So our PPT is titled The Heartbreak Hotel, Understanding the Drama of Myocardial Infarction Pathology. And I am Vishwanath here, your tutor for teaching you myocardial infarction in detail. Okay. So let's start. So what is myocardial infarction? Basically is that myocardial infarction is something which is blocking the tissues of heart, like preventing the tissues in order to get oxygen. That's why there is death of the tissue due to depletion of oxygen. So that's myocardial infarction. Basically myocardial infarction, so get ready to explore the dramatic world of myocardial infarction pathology, and let's start with this PPT. So what is myocardial infarction? A myocardial infarction is basically commonly known as a heart attack. A heart attack occurs when blood flow through the heart is blocked. This can lead to tissue damage and serious health issues. So understanding this condition is essential for prevention and treatment. So talking about myocardial infarction, basically we have a spectrum of disorders. So we have got a spectrum for that. So talking about the spectrum means we have ischemia here. We have ischemia. Ischemia means there is a depletion of oxygen, not a complete loss, depletion of oxygen. This ischemia leads to angina. Angina is called the chest pain, acute chest pain or acute chest congestion, chest pain. Angina may be a stable angina or an unstable angina. Stable angina means that the angina is due to on exertion. This appears on exertion, on doing some work, right? And unstable angina means it appears without any exertion. So in ischemia there is no infarct present. There is no infarct. There is no tissue death. There is no tissue death. And ECG changes are present, but there are no cardiac elevation. Like there are changes on ECG like T wave inversion or ST elevation. These are present on an ischemia itself, right? But no cardiac enzymes are involved. Next, then we have myocardial infarction in toto. Then we have chronic IHD with heart failure. Okay, ischemic heart disease, chronic ischemic heart disease with heart failure. Here, what is the etiology? So basically, we have a multiple, atheromatous plagues due to which, due to multiple MIs, and this will cause the compromised cardiac functions, and this will cause ischemic cardiomyopathy. And this ischemic cardiomyopathy will lead to heart failure. Okay, so this is one spectrum, and then we can have acute coronary syndrome as well. So 4 disorders in the spectrum, or we can have an acute coronary syndrome as well. Okay, after this let's move on to the next slide. So basically for myocardial infarction we must have a basic idea of the heart's anatomy. So I guess you all know about the heart's anatomy, right? Heart has 4 chambers, the atria and the ventricles, you all know that. And these things you all know. So basically now we'll see a picture in which we'll look at the heart in this view. So I'm basically cutting the heart like this and looking at the walls, right? So this is the left descending branch of coronary artery, left descending branch, right? And this is the left circumflex branch, and this is basically posterior descending branch of right coronary artery, right? So this is the thing, and then we have the walls like this. So this is the right ventricle, this is the left ventricle. So this basic anatomy you must know in order to understand the types of infarcts, the transmural infarcts and the non-transmural infarcts. And then we have another type also, which is called as the multifocal infarcts, right? So let's discuss about the types of infarcts now. Before talking about, okay, let's talk here only. So this is if this is a blood vessel, if this is a blood vessel which is present over here, and there is a complete obstruction in the blood vessel, a complete obstruction. So the obstruction is complete, and if the thrombus is not treated, okay, the thrombus is remained, then there is complete destruction of the heart wall. Let's say this is the wall of the heart. There is complete destruction. Okay, so there is a full thickness of heart wall. Full thickness of the heart wall is basically affected. So this type of infarct is called as the transmural infarct. Right? Transmural infarct. And this is a permanent occlusion. If MI is untreated, this happens. But if the thrombus is partly treated, right? If the thrombus is partly treated like this, partly treated, then we can have subendocardial infarct, right? Where the inner 1/3 of endocardium is infarcted. In this, the inner 1/3 of endocardium is infarcted. Understood? Or we can have multifocal infarct, in which multiple intramural arteries are infarcted, right? Or we can have another type of infarct. So this is the first type, transmural. This is the second type, subendocardial. Or we can have the third type, that is the multifocal infarcts. So in multifocal infarcts, what happens? Small multiple areas are basically infarcted, right? If this is the heart wall, then we can have infarct here. So what are the etiologies? Either we can have increased catecholamines. Increased catecholamines will cause intense vasospasm, and this may occur due to intense vasospasm. Or we can have a type of vasculitis. For example, we can have PAN, or we can have Kawasaki disease in children. Okay, this type of vasculitis. So this can also lead to multifocal infarcts. Or we can have drugs like cocaine. Okay, we can have drugs like cocaine, which can also cause this type of multifocal infarcts, right? So these are the etiologies for multifocal infarcts. Done. So this can be caused by various risk factors. Risk factors are as follows, like atherosclerosis. There may be atherosclerotic plaque, high blood pressure, okay, hypertension basically. So basically you just understand that global hypertension. So if there is a global hypertension, this can also occlude the arteries, and this global hypertension can cause an infarct, which is an example of subendocardial infarct. So hypertension can cause subendocardial infarcts. And smoking also. Understood? So I told about all the etiologies as well as the types of infarcts here. Now let's move on to the next part of our slide. Okay, before symptoms, we'll move to the post-mortem appearance. So I have kept a blank page for that. So let's discuss about post-mortem appearance. of MI, post-mortem appearance of MI, right? So talking about post-mortem appearance of MI, if a person is brought dead, to find the etiology of death, the post-mortem must be done, right? So we basically take the heart and take sections of the heart. The heart sections are taken like this, and we do staining. And it is cut into 1 cm slices. Okay, cut into 1 cm slices and put in triphenyl tetrazolium chloride, that TTC. Put in triphenyl tetrazolium chloride. So it stains red in color like this. So basically this red dye becomes pale if there is extracellular LDH, and LDH is a marker of myocardial infarction. So this red, if it turns yellow, not yellow, you can say pale if LDH is present, and no color change if LDH is absent. And LDH is a cardiac marker. So this is a necrotic tissue, that is this is your MI, and this is a non-MI case, right? So this type of thing is used to determine if your infarct is present or not, right? Look at the picture now. Look at this. So this is a picture where this part, just look at this part. This part is an infarct. This is an infarct, right? This is an infarct. Understood? So it is the all parts are red in color, but this part has turned pale. That is, it indicates the presence of LDH. And this post-mortem appearance, this basically the microscopy. We do microscopy also to know the age of infarct. So age of infarct is an important topic. So let's discuss about age of infarct. So if a myocardial infarction has occurred, how will you know age of infarct? By looking at the microscopy. So 0 to 12 hours, 0 to half hours or 30 minutes, you can say. 0 to half hours, there is no microscopic finding. Half hour to 4 hours, the first finding appears. Your half hour to 4 hour, the first signs appear, and this is called as the waviness of fibers, basically. Okay, so fibers become waviness of fibers. This type of fibers become like this. This is also called as the buckling effect. Right? If you want to see a picture, just see. Look at this. This is the picture when there is waviness of fibers. You can observe the waviness of fibers, but this is a little bit older infarct. Why I will tell you, right? But this is basically after 4 to 24 hours, right? We'll see. So this is just half hour to 4 hours. Then let's discuss about 4 hour to 24 hour. So 4 hour to 24 hour, there will be necrosis. Which type of necrosis is seen in heart failure or heart? So basically we have coagulative necrosis. Right? So coagulative necrosis plus you will see neutrophils. Right? This is the microscopic finding. Then 1 to 3 days, there will be necrosis, and of course the same coagulative necrosis. plus your neutrophils. Neutrophils, here the neutrophils are max in number. Done. So let's see the picture of a infarct which is 1 to 3 days old. So just look at this picture. This pink areas which you are observing, these pink areas are the areas of necrosis. Areas of necrosis. And you can see the inflammatory cells, the neutrophils and all. That's neutrophils. Right? So this is an infarct. After neutrophils, what comes? After neutrophils, there will be coming of macrophages, right? There will be coming of macrophages. Understood? So when we the infarct becomes a little bit old, like 4 to 7 days, there will be macrophages. There will be macrophages. Right? Then macrophages will remove the necrotic tissue and neutrophils, and this is the weakest point of this is said to be the weakest point of scar. Weakest point of scar, right? Because there is a dearth of tissues, this macrophages will remove all the debris, and 7 to 10 days you will see something called granulation tissue. Granulation tissue, and more than 10 to 14 days you can say we'll see scar, and this scar will have collagen. So if you stain with Mason's trichome, so this will be a blue appearance. This will have a blue appearance, right? So let's see the infarcts of 4 to 7 days, 7 to 10 and 10 to 14 days with a picture. Okay, look at this. This is a, you can guess, 4 to 7 days. Why? Because we have clear areas, and this clear areas indicate macrophages, right? And then this is 7 to 10 days. You can see the presence of a granulation tissue, right? It appears like this in microscopy. And then 10 to 14 days, a healed scar. So we have stained it with Mason's trichome, and the blue portions you can observe because the collagen is present. So there is a collagen excess present over here, right? So that were about our postmortem changes. So we saw what is the age of infarct and postmortem appearance of MI, and then we'll move to our other things of MI, okay, like the complications of MI. Let's talk about the complications of MI then after this. So again a blank page, we'll talk about complications of MI. So talking about the complications of MI, complications we can have many things, like we have at least 7 complications you can say. Okay, at least 7 complications, and we'll see one by one about what are the complications. So the first one is your arrhythmias, right? The first complication is called as your arrhythmias. Arrhythmias, and if there is a ventricular fibrillation, it will lead to death in early MI. Okay, it will lead to early death, right? Then we can have contractile dysfunction. There may be if due to contractile dysfunction, much blood is not pumped here, right? The blood pumping capability is very reduced. Okay, reduced blood pumping, and due to this reduced blood pumping, there is a state of cardiogenic shock. So basically about 40% left ventricle is involved. If 40% left ventricle is involved, obviously there will be a state of cardiogenic shock, and this may lead to cardiac failure. We can have the third complication, that is the papillary muscle dysfunction. Papillary muscle dysfunction, right? Papillary muscle dysfunction, which will this papillary muscles, you know about what are the papillary muscles. If you have seen the heart, you must know that. So what are the papillary muscles? You know, our valves are present, right? So these valves are attached to some muscles like this, which are chordate tendini, and this chordate tendini goes to this type of muscles present in the wall of heart. These muscles are called as the papillary muscles. And if there is a dysfunction of the papillary muscles, this chordate tendini will become loose, and due to this loosening, the blood will try to regurgitate, right? So there is a regurgitation of blood. Regurgitation of blood. Okay. Then the fourth complication of MI, fourth complication is your ventricular rupture. Basically is a ventricular rupture which occurs most commonly in elderly people. Like if we have a transmural infarct, it can lead to ventricular rupture. Ventricular rupture. And this went due to you know about the weakest point of the scar, right? I talked to you about the weakest point of the scar, where this part, just look, this part. If we have a infarct at this part, it can lead to ventricular rupture, because this is the weakest point of scar, right? So we have a tendency of ventricular rupture at about 4 to 7 days. So this time period is important, right? So we can have a ventricular rupture here, and this ventricular rupture will manifest as cardiac tamponade. Cardiac tamponade. So this is the clinical feature of ventricular rupture. Cardiac tamponade means the compression of heart due to your blood in pericardial space. So basically what will happen is that if this is the pericardium which is surrounding the heart, so we'll have our accumulation of blood in the pericardial space due to the ventricular rupture. Ventricles have ruptured, due to which the blood has now flowed into the pericardial space, and due to this fluid accumulation, this fluid buildup, it will exert pressure on the heart. So basically there is a pressure on heart which is increasing, and this is called as the cardiac tamponade, right? Are you understanding? Yes. Then we can have something called as the pericarditis. Pericarditis. So what is pericarditis? Pericarditis means the inflammation of the pericardium due to irritation of due to irritation of pericardium, there is an inflammation. It may occur within 2 to 3 days of MI, or within 2 to 3 weeks post MI. We can have basically two types of pericarditis, right? We can have fibrinoid type, or we can have your Dressless syndrome, something called as a Dressless syndrome. Fibrinoid pericarditis or Dressless syndrome. What are these entities? This is basically a normal thing which is due to the inflammation of pericardium, and this occurs 2 to 3 days post MI, right? But this Dressless syndrome occurs 2 to 3 week post MI. This occurs 2 to 3 week post MI, right? Here it is basically, Dressless syndrome is basically a immune disease. You can say autoimmune disease. Autoimmune response is involved over here. Autoimmune response means what happens is basically due to damage of the cardiac walls, a new antigen formation occurs. You must have known the concept of new antigen till now. New antigen, due to which there is an autoimmune response, and due to this autoimmune response there will be a pericarditis, right? Okay, so this is a complication. Or and other complications of MI, like we can have embolism, or we can have aneurysms. Okay, So these are the 7 complications of MI. These are the 7 complications of MI. Now let's look at a picture from your Robbins textbook. We'll discuss the picture now. Okay, look at the pictures. This one first. So this one basically is a picture which is showing your myocardial rupture. This is myocardial rupture, which is also a complication of MI, right? And this one also, this is also a myocardial rupture. This is a myocardial rupture, right? And here there is, you can see over here, the papillary muscles have ruptured. So here we call it as papillary muscle rupture, muscle dysfunction. And I told you, due to papillary muscle dysfunction, there will be a regurgitation of blood, regurgitation of valves, and due to this there will be regurgitation of blood as well, right? This is a complication, right? And here this appearance is called as the fibrinoid pericarditis. This is your fibrinoid pericarditis, fibrinoid pericarditis. Okay, this is basically thrombus, and this is a ventricular aneurysm. This is a ventricular aneurysm, right? So these are the things which you have to know. This pictures may come in spotters, that's why I discussed. Otherwise we have to know just these complications only which I have written, right? So that were about complications of MI. Then talking about the diagnosis and test, this is an aspect of biochemistry. So doctors use various tests to diagnose myocardial infarction, include ECG, blood test, and imaging. Okay, of course you know what are the things which you have to know. Okay, first let's talk about something called as a reperfusion injury, then we'll go into that part. Reperfusion injury. So talking about reperfusion injury, what is that? So basically what happens is that due to thrombolysis or anything which is done to, you know, remove the block which is there. Let's say here is our heart, and here was our blood vessel which is basically blocked here, right? So we did an intervention, like we either did thrombolysis, or we did your posterior circumflex artery angioplasty, anything to remove the block, so this is called as a reperfusion. Perfusion is basically the bringing of oxygen, okay, the supplying of oxygen. Reperfusion means it was blocked now, and now we are doing any procedure to reperfuse it. So this reperfusion have some side effects, due to which we can have something called as a reperfusion injury. Okay, you can have reperfusion injury. So and that is reperfusion injury. And what is the cause of reperfusion injury? Most common cause is the reactive oxygen species, right? So what happens is that the normal blood was going normally to the heart. This is the heart, but now it was blocked from some time later due to the MI. Due to MI it was blocked, and now again when we did reperfusion, the blood, there is a traveling of new blood. So now new blood is going to the dry tissue, due to which the dry tissue will start reacting in an abnormal way, because it had not seen blood from a very long time. So there will be generation of ROS, generation of reactive oxygen species, which will lead to damage. There will be generation of WBCs, which will clog the capillaries, or there may be increase in calcium, which will cause injuries, right? So reperfusion will increase the calcium and cause this increased calcium can also cause hypercontraction of the fibers, heart fibers, hypercontraction of drying fibers, hypercontraction of drying fibers, which will cause the formation of eosinophilic contraction band, something called as the eosinophilic contraction band forms. So what is this eosinophilic contraction band? Basically, we'll see pink colored bands which are present, and this pink color bands are because of a hypercontractile state of the fibers which were previously dying, right? So basically, if you want to see the picture of your reperfusion bands or eosinophilic contraction bands, let me show you. Okay, so you can see this type of bands over here. Look at this part, the arrow. You can see a darker portion here, right? This one, this one, this one, this one, this one. Many small bands you can observe like this. Observe, right? So these are the reperfusion bands due to hypercontractile state and increased calcium which is seen in the reperfusion injury, right? And that were the things which you have to know. Okay, then what is the golden hour? The golden hour of thrombolysis is basically the statement determined by the history of chest pain. Like beforewards, it is the benefit more than risk, but afterwards, it is the risk more than benefit. Okay, because after the golden hour, a patient is very difficult to being saved from the MI, right? So golden period and all you read in medicine. We have to discuss the pathological aspects. Basically, complications is done. We talked about reperfusion injury, we talked about the complications of MI. Okay, so we are almost till the end of our pathological aspects now, right? So diagnostic aspects, we can do ECGs, we can do blood tests and imaging. So ECG findings, obviously we'll see ST elevation and T wave inversion, right? T wave inversion, this all things we will read in medicine in more detail. Blood tests and imaging, and we can also do serology. We can use cardiac markers like CK, okay, CK, and LDH, okay, troponins, TPI basically. So all these are cardiac markers which will see an increase in case of MI, and serological tests are basically working to you can say indicate that if an MI has occurred or not, right? So basically if you want to write, you can just write, you can note down the cardiac biomarkers like elevated troponins, you can write like TPI and TPT, right? You can write elevated CK, that is creatine kinase, or CKMB, that CKMB will be elevated myoglobin, right? These are the cardiac biomarkers. And ECG change, there will be an ST elevation, or there may be depression only. You can just write ST elevation, right? And if you do some imaging as well, if you do some imaging studies as well, then you can do echo will show wall motion, or you can do an cardiac MRI, or you can do something called coronary angiography, right, which will show the occluded or stenosed coronary arteries here. Understood? So these are the ECG changes. These are the, just make box and write. So these are the ECG findings. These are the laboratory diagnosis or lab findings, and these are the imaging modalities, right? So that were in the diagnosis and the tests. Let's move to the clinical presentation which we left behind when we were discussing. So symptoms to watch for: recognizing the symptoms of a heart attack can save life. Commonly chest pain, shortness of breath and nausea. Okay, so basically there will be chest discomfort first, chest pain or discomfort. there is a shortness of breath, there is nausea, there is fatigue, there is pain or discomfort in arms, neck, jaw, right? You can have pain or discomfort here. This type of things may occur, right? Okay, treatment options available. Let's discuss about some treatment options. So we can have emergency medical treatment, right? If it, as it is an emergency option, so emergency medical treatment, we can either give oxygen therapy, we should manage the pain management by giving some different things like morphine, right? And aspirin may be given. You can give nitrates sublingually like nitroglycerin. You can give beta blockers. Understood? So these are the things. And if you want to talk about some medications, so medications, we can use a variety of class of medicines for MI. Like you can give first you can give antiplatelet drugs like aspirin, clopidogrel. You can give anticoagulants like heparin, warfarin. You can give beta blockers. You can give ACE inhibitors. You can give statins to decrease the cholesterol levels and all. You can give nitrates, right, like nitroglycerin, or you can give calcium channel blockers. So these are all the list of medications you can give for MI, right? Or you can do some surgical interventions, like you can do CABG. CABG is coronary artery bypass grafting, or you can do PCI, that is percutaneous coronary intervention with stents. Okay, you can use stents also. Stenting is done. So emergency treatment, we talked about medications which you can give, and we talked about some surgical options as well. Then these all medications, angioplasty or bypass surgery, these all are things. Then we talked about discussed about the treatments which can help us recover, and we can do lifestyle modifications as well. These are important because prevention is better than cure, as we all say. So lifestyle modifications, you can stop the risk factors like smoking. You shouldn't smoke. Or you can use a low fat low sodium diet. Exercise, yoga, weight management. Okay, you can do this kind of things. So that were about our treatment options which are available. Understood? So that were about the treatment options. So heart health tips: prevention is better than cure, and balanced diet is required. Regular exercise, avoid smoking. This will reduce the risk of myocardial infarction basically, right? And emotional impact: experiencing a heart attack can have a profound emotional impact on families. Feelings of fear, anxiety and depression are common. So there must be some psychological counseling as well. And stay connected with family members and spend time. So I guess you all know this kind of things, right? Conclusion: heartbreak no more. Understanding myocardial infarction is very crucial. That's why I took this session. It is a very important session for as a doctor also and as a human also. So we all can work towards a healthier heart together. Let's turn heartbreak into hope. Thanks. So that's all in today's lecture. If you have any doubt in the lecture, you can DM me on Tripathi underscore, which is my Instagram ID. That's all. Bye bye. Take care and see you in other lectures.